Okay, good morning, dearest. Welcome to my YouTube channel, and today I am taking you through sexually transmitted diseases and pelvic inflammatory disease. And the one delivering is Associate Professor Engineer Dr. Mhos Dennis Kofaras. I am a senior gynecologist at the Afritech International Hospital, and I've been handling this issue after my engineering course, and I had a passion for medicine, and specifically I went for gynecology. So I'm glad to be with you, and I'm sharing with you one thing that is affecting people in the world, especially those who are sexually active. And today, by the end of this lecture, you will have gotten something good. At the end of this lesson, the students will be able to state the magnitude of STDs, differentiate between STDs that cause abnormal discharge and genital ulcer, discuss clinical presentation and management of some of the common STDs, and discuss pelvic inflammatory diseases. Introduction. So these STDs affect any of the genital organs in females and males. Worldwide, at least 250 million new cases of STDs occur each year. Trichomoniasis, 120 million cases once a year. Chlamydia, 50 million cases a year. Human papillomavirus, gonorrhea, and herpes simplex virus, that is 20 to 30 million cases each year. Women are at a higher risk. Why? They have a low status. That is one thing that limits their ability to negotiate safer sex and access to information and health care. Most females have fallen prey of STIs because they have limited ability to negotiate. You're staying in a person's house and you cannot negotiate whether you can actually use a safe method like a condom or what. Or maybe you are a sex worker, you don't have anything to negotiate. He has paid you and you have to accept the terms. Now, there are those with females have a larger vaginal surface area than the penis and more vulnerable to infection. That's something that is the anatomic nature, or I'm saying anatomy of the nature of the women is makes them vulnerable. Then we have STIs. They are symptomatic in women. Some women have STIs, but they don't actually affect them. But when you a man go there, you will get hell out of there. But for them, they'll be okay. Delivery-related blood transfusions may expose women to HIV and hepatitis B. Sometimes during delivery, they do blood transfusion, and you find they have no chance to select because they want to save the life, and they end up exposing the women to HIV and hepatitis B. Now, we have finished those ones. Now we go to etiology and common presentation. Now, we always want to see how do these STIs present themselves. We have vaginal discharge, something that is common. If you see you have a discharge that is of a cervical origin or the vaginal origin, you know it's chlamydia, that's gonorrhea, or herpes trichomonas. Sometimes the vaginal origin can be candidiasis. You check where it is coming from, trichomonas or bacterial vaginosis. And now, the etiology and common presentation. We have those which have the genital ulcer disease. The most common causes, we have syphilis. You know what ulcer is like? A wound. So syphilis, we have a chancroid, we have herpes. Other causes, we have trauma, we have scabies, we have other diseases. Now, morbidity from STDs, we have a chronic lower. How do you sometimes when they have occurred to you, you have something that it can happen to you. Some people experience chronic lower abdominal pain. So when you're a female or a male, you feel lower abdominal pain, you know there's an STI. Some, if it goes untreated, cause infertility. In women, it causes ectopic pregnancy. Now that is why it causes spontaneous abortion. Sometimes you find a woman is aborting, first child aborted, second aborted, you know this is an STI. Cervical cancer can cause it. Premature rupture of membranes, preterm delivery, If you have an STI, some women deliver prematurely. That's called preterm labor. We have perinatal and neonatal infections. These cause mental retardation, blindness, low birth weight, stillbirth, meningitis, and death. That's why when you go to these big hospitals, that have access to these testing facilities, if you are a pregnant woman, the first thing they test is see whether you have STIs, because they have an effect on the child that you're going to bear. We have social stigma. Sometimes when you say I have gonorrhea, now people see you, oh, you have the stigma in the society. Even some fear to talk about it. So the women, oh, I have this kind of disease that is pressing me slowly, but you can't say it out. You can't say it out emotionally. You can't be with the people. You are just there. Even the other people begin now as isolating you sometimes, because that thing you have is you have the stigma. Because another one, management history, this perennium. Some you if you are now asking the person, maybe has come to you and is saying you see this vaginal discharge, genital skin lesion. Some people, the skin you see on the genital, think on the private area, the genital, the pubic area. Then abdominal vaginal bleeding. Some, if you do that and you have genital burning, you feel itching is there, genital itching. Then genital mal odor, that is something like bad odor, mal odor. Then you have low abdominal pain or pelvic pain. Now, so that's our lesson. We shall pick up from there, and we shall do, when you come to me as a consultant gynecologist, what I will do is the physical examination, but we shall cover it next lesson. Thank you for listening to me. I have the passion for medicine, and I long to sort people's lives and solve the problem they are facing.